Good morning, everyone. How are you? Hope you had a wonderful Halloween and happy 1st of November. Happy Day of the Dead if you celebrate. Yeah, I just wanted to check in with you guys and give you a little bit of a TTC update. We last kind of left off with basically letting you know how the HSG test went. So we talked about our raw thoughts like right before I went in, and then kind of wrapping up how it actually went. And the last thing that we talked about was I have they were thinking I had a cornered uterus. So if you think of a uterus, it's in the shape of a triangle, right? Kind of. Google that shit. And mine is just a little bit like, I should have had paper to show you, but it's sort of like, okay, watch my finger. It's like this, and then it kind of goes in and down versus that, right? So due to the HSG test, my tubes are not blocked, so everything is good to go there. They said that I had ovulated a couple days before beautifully. They can tell from the path of the egg had dropped that I had done that. And it was my maybe 7th day or 8th day? I don't know. And this was all before our wedding. So this was all about a week before our wedding. We had the HSG test. So because they saw that I had a bit of a cornered uterus, so a bit of a T shape versus a triangle shape, they had some concern that it was going to be what is called and diagnosed as a cornered uterus, which is an issue. It's not so much an issue for getting pregnant, but it would be an issue for miscarriage. This was not great news. We were pretty scared. We spoke with our fertility doctor. He had us come in, and he wanted us to have a scan. So he wanted us to have a 3D ultrasound. So this all came out of the HSG test, guys. So we were nervous about it. I was terrified for it. We had it. The reason that we were in there for the HSG was to make sure that my tubes were not blocked. They weren't great news. And then we find out the shape of my uterus is in question. So we weren't going in there for that, and that's the news that we came out of. So it was like bittersweet knowing that all of my tubes are fully not blocked. Everything went, the dye went through. We could see it. Sewell could see it on the sonogram, and then it was the shape in question. So our doctor basically told me when I went to visit him, I think Sewell was working that day, basically, let's get you in for a 3D ultrasound and see what happens. It turns out that the day that we could do it was the morning before our wedding. So the morning before our wedding, we went in for a 3D internal vaginal ultrasound. More so than a regular ultrasound. Like if anyone is TTCing, the thing that they use, the internal ultrasound where they go in. This is like intense, and they do it inside, so vaginally, but they also do it on top, so a full ultrasound as if you were pregnant. The day before our wedding, we just decided we're gonna do this because we want to get this done, and we're going on our honeymoon for 2 weeks, meaning that if timing worked out, we were going to start our first insemination, our first cycle, when we get back from our wedding. So let's do this ultrasound. So we find out, depending on the results, surgery could come out of this. We are mind blown. We weren't prepared for this. My doctors, our doctor, our fertility doctor, also said this could be a complete version of the norm. So yep, I don't have a typical shaped uterus, but it could be a complete version of the norm, they called it, variation of the norm, and no issues, no worries, and we could continue on. So Sewell and I had a rough time with that, but we said, let's do it. Let's do the 3D ultrasound the day before our wedding. Let's hold off on the results until after our honeymoon. So we were going to be thinking about this, not having the results for our honeymoon. Let's do it. Let's get it done. Knowing that surgery could possibly come out of this, we had to decide what we were going to do as a couple. So we talked about it, we researched it, we talked with friends, we talked with family, and we decided that despite the outcome, whether I had a diagnosis of cornered uterus or not, we were not going to elect for surgery. So Sewell and I, we had decided as a family that if we got bad news, we're gonna continue. If we try and have our IUIs and we have a successful pregnancy and then that's a loss of a pregnancy, so we have a miscarriage, then we will talk about surgery. Okay, it's actually happened. This was a negative outcome. Now let's talk about surgery, but not before that. So we had already decided that. If all systems were a go and it was a variation of the norm, my shape of my uterus, then it's literally all systems are a go. Our doctor would give us the green light and we would have our IUI. But it would to at least have had that discussion together that we were not going to elect to have surgery beforehand. This was nuts, you guys. This was a week before our wedding. We were going in for this ultrasound a day before our wedding.